Well, we have quite a few people on the line already, and I want to extend a welcome to all of you who have joined this Teletown Hall. My name is Doug Shadel, State Director for AARP Washington. I want to thank you for joining this important discussion on the global coronavirus pandemic. AARP Washington is a nonprofit, nonpartisan member organization that has been working to promote the health and well-being of older Americans for more than 60 years. And in the face of the global coronavirus pandemic, AARP is providing information and resources to help older adults and those caring for them. I think we are all grateful that 2020 is in the rearview mirror. COVID, of course, is still with us and will be for some time. But 2021 holds the promise of broad vaccine distribution across the country. And as we move into March, major challenges remain. The virus is mutated, and continued outbreaks nationwide show just how difficult prevention efforts can be. And while vaccines are on the way, supply is limited, distribution has been slow, and many Americans continue to feel the emotional and financial hardship from the pandemic and fears about what is to come. Well, today we're fortunate to have some very special guests to discuss these issues. In a few minutes, we will be discussing the vaccine process with Washington State Secretary of Health, Dr. Umair Shah, whose office has been proactively working on the vaccine rollout since before vaccines were approved in December. We will be discussing the current phases of the vaccine distribution process and answer your questions. And along those lines, if you have a question for our guest, press *3 on your telephone keypad now to be connected to an AARP staff person who will note your name and question and place you in the queue to ask that question live. Again, press *3 on your keypad if you'd like to ask Dr. Shah a question. Later in the call, we will be joined by State Attorney General Bob Ferguson, who will give us an update on how scammers are using the confusion surrounding the pandemic and vaccination process to scam people out of money and personal information. Now, again, if you've participated in one of our Teletown Halls before, you know this is similar to a radio talk show, and you have the opportunity to ask questions. As I mentioned, for those of you on the phone, if you'd like to ask a question about the coronavirus pandemic or the vaccine, press *3, and you'll be connected to a staff person who can take your question and put you in the queue. If you're listening through our Facebook audio stream, please leave your question in the comments section. Our first guest today is Washington State Secretary of Health, Dr. Umair Shah. Prior to moving to Washington State, Dr. Shah led the Harris County Public Health Department in Texas for the last 7 years, managing 700 public health staff, serving the 4.7 million residents in the nation's third largest county. And before working for the county, he was Chief Medical Officer of Galveston County Health District and has served as an emergency department physician at Houston's DeBakey VA Hospital for over 20 years. Well, thank you for taking time out of your busy schedule to be with us today, Dr. Shah. We know there's a lot of uncertainty among our members about the vaccination process. Can you tell us just a little bit about the phased rollout and the kinds of things you're working on?
Yeah, sure. Thank you, Doug. First of all, thank you for hosting me, and I want to thank AARP for the fantastic work that you do to really focus and serve our seniors, not just across Washington, but across this nation. I really just want to say a shout out to you and your team for just such a difficult time in making sure that you provide the support to those who are older in our communities. I also want to say that there is really, as you talked about in the opening, with my work over 20 years at the VA hospital system within Texas, I will tell you that working and taking care of not only our nation's veterans, but oftentimes many of them who are seniors, has been one of the biggest opportunities and real challenges that I've had over my career. And so I just wanted to just recognize the important work that different systems of healthcare play. I am now the Secretary of Health in Washington. I'm recent to this position. It's probably not the best time to make a transition from one state to another, but that's exactly what I'm doing, and obviously making a move into the state of Washington, where we have so many issues right now and challenges, just as we do have across the country, related to COVID, but most importantly, COVID vaccine. And so I really want to just first of all underscore that there are it's a three-legged stool when it comes to vaccine or COVID vaccine in the country. And one is vaccine supply. That's the first leg. The second leg is all the things we have to do with logistics and administration and scheduling and all the other things. That's the second leg. And the third leg is vaccine demand. And right now, the good news is that we have so much more demand than we have supply of the vaccine. But we do know that over time, we are going to obviously have the supply catch up, and we want to do everything we can to make sure that Washingtonians, regardless of age, as long as they're above the age of 16, of course, because the vaccines have only been tested in 16 and above, that they are able to get the vaccine, in essence, as quickly and as equitably as possible. We have a limited supply of vaccine, as I've mentioned, so we've had to prioritize our communities that are most vulnerable, or members of our communities that are most vulnerable. And that means that our prioritization work, which has worked very much hand in hand under the leadership of Governor Inslee, has been for the Department of Health working with our partners on the ground for those who work in healthcare settings, anyone over the age of 65, those who are over the age of 50 but live in a multi-generational household, and last week, the addition of pre-K through 12th grade school systems and child care providers, so educators. But I do think it's really critical that we emphasize, especially in a call with your members, that anyone over the age of 65, I want to do everything we can to get you vaccinated. And why do I say that? Well, I say that because we know that seniors and age as a risk factor is absolutely important for fighting this pandemic. In other words, the older you are, and if you take everything else aside, other conditions, everything else, other where you live, but just age, especially over the age of 65, puts you at particular risk for COVID. Not to get COVID necessarily, but if you were to get infected with COVID, the more risk for having a not so pleasant outcome. In other words, not a mild illness, but a hospitalization or something worse. And we want to make sure that we're protecting our seniors the best that we can. So I think it's absolutely critical that we, first of all, recognize that we have on the Department of Health website, findyourphasewa.org, findyourphasewa.org, to see if it is your turn. But obviously, most seniors that are on this call, unless they're under the age of 65, should be eligible. If you need assistance in navigating the tool, you can also call 1-800-525-0127. That's 1-800-525-0127. Then press pound, and the folks on the phone can help. And we also have translation services available as well, Doug. So the tips that I would give for seniors for getting a vaccine appointment is, first of all, go to this findyourphasewa.org, go to the Department of Health website, or go to the website of your local health department in Washington, keeping check on locations at Department of Health that show where vaccine supply has come in for certain locations, and we are updating so that you can see who has received the vaccine. So you can then make contact with that provider to schedule your appointment. Now that may be easier said than done, because remember, we have quite a bit, and I mean quite a bit more vaccine demand, people wanting the vaccine, than we do have the supply coming in from the federal government right now. Anyone can go to any vaccine location in their county if they are eligible and have an appointment. So be sure to try all the options that are listed. I think it's absolutely critical that we also emphasize that there are 3 vaccines now. There is the Pfizer vaccine, there is the Johnson & Johnson vaccine, and there's the Moderna vaccine. The Pfizer and the the Pfizer and the Moderna vaccine are 2-shot vaccines. They are very safe. They are very effective. The Johnson & Johnson vaccine, which has we just started receiving this last week into the state of Washington, is a 1-shot vaccine, but it is also effective and safe. So the bottom line is all 3 vaccines, Pfizer, Moderna, and J&J, Johnson & Johnson, are safe, they're effective, and if you are offered and eligible for any one of those 3 vaccines, my advice is don't hesitate, vaccinate. Do not try to get the perfect situation or scenario. Somebody is offering you the vaccine, get it. And we have now administered over 2 million doses of vaccine in the state of Washington as of yesterday. So, Doug, with that, I'll just stop right now and just say there's just an incredible amount of work that's happening. I want to thank our partners on the ground and throughout the state of Washington, our federal partners. We still have a long road ahead because we don't have enough vaccine supply, but we know that is going to improve in time. So with that, I'll turn it back to you.
Well, thank you very much. If you're just joining us, you're listening to a Teletown Hall about the coronavirus and vaccine, and you've just been listening to Washington State Secretary of Health, Dr. Umair Shah, who's been kind enough to take time out of his busy schedule to be with us today. My name is Doug Shadel from AARP Washington. And if you'd like to ask, and later we'll be hearing from Washington Attorney General Bob Ferguson. If you'd like to ask one of our guests a question, all you have to do is press *3 on your telephone keypad, and you'll be connected to a staff. And boy, do we have a lot of questions and a lot of people. There's over 5,000 people on this call. So I think we ought to get right to it. Let's start with Martha from Marysville. You have a question?
I do have a question. Once seniors get 2 doses of vaccine, what socially can we do with our friends also that have had 2 doses of vaccine?
Well, thank you so much for that question. There's some information that just came out from the CDC yesterday, the Centers for Disease Control and Prevention. And really, we're continuing to see this information. And I would say there are probably 2 ways of looking at this. There's information right now that is based on what we have right now, maybe about 10% of the population across the country that's been vaccinated. And we are going to be finding that there is guidance that we're giving today, but that is going to likely be different than, not different, I should say, but enhanced guidance that will also happen once we get into vaccine more coverage across the country in the later months, like in the summer. So I think it's really important to know that whatever I'm going to say right now is going to evolve over time. But in general, if you have received your 2 vaccine doses, what the CDC released yesterday was the fact that you can now start to have limited interactions. Again, we don't want to have large gatherings, but limited interactions with others who have also received their 2 vaccines. We want to make sure that it's important that you are in contact with or around people who have also received their vaccines. The risk is lower than for transmission if you've already received your 2 vaccines, or in the case of Johnson & Johnson, one shot. But remember, it's generally about 2 weeks after either your second dose of Moderna or Pfizer, or after the Johnson & Johnson, your first dose of the Johnson & Johnson, it's 2 weeks after that. So you don't want to just get your vaccine yesterday, either the second dose of Pfizer, Moderna, or the first dose of Johnson & Johnson, and just say, okay, I'm ready, I'm protected. You've got to wait a couple of weeks. But then there's some very specific information on what people can do, which is being able to do things like be able to be with family and be able to even hug grandkids, those kinds of things. But we want to make sure that people are still taking precautions that are, if you're around people you don't know, we want to make sure you're especially wearing your masks and your social distance and all those other things. But if you know that the people around you have also been safely vaccinated, then you know that both you and that other individual or set of individuals are protected. Now, what it does not, this guidance say, is that you can go and travel willy-nilly. We want to make sure that we are still remembering, and the CDC director said this yesterday, that travel Whenever we've had increases in travel, we've had increases in surge of COVID transmission. So I wouldn't open it up to saying go do everything, but we do think you can do some limited things. And then as we get more information over the next few months, as more people get vaccinated, then I'm sure you're going to get updated guidance from the CDC.
Well, thank you very much. If you're just joining us, this is a Teletown Hall on the coronavirus and the vaccine distribution. You've been listening to Washington State Secretary of Health, Dr. Umair Shah, and we will be bringing on Washington Attorney General Bob Ferguson in a minute. But let's get to some more questions. Let's see. Go ahead. You have a question? Jack, are you on the line?
Yes.
Go ahead.
Yes, I am. Hey, listen, if
your question.
Huh? Are you still there?
Go ahead and ask your question.
Okay.
It's fine.
Okay. My question is, if I get the second shot of the Pfizer, how protective is that of the variants that are coming around seemingly daily?
Yeah, that's a great question. So I think the first thing we have to remember is that all three vaccines are extremely effective. All three vaccines are extremely safe. So do not, again, hesitate, vaccinate. That's the key message. When it comes to the variants, what I would also remind us is that variants, for those who may not know, is really a kind of a fancy common term for the word mutation. It pretty much means that the virus has changed. That is the natural course of viruses. I've been in the field of public health and medicine for 20 plus years, and I will tell you that that's what we know about viruses. That they're what I call this COVID-19 virus. It's a super slick virus that's broken every rule in the playbook. Why? Because it keeps changing. It keeps evolving. It is not shocking or surprising that this virus is having some change of its way to try to infect people, because that's what viruses do, right? When they realize that there is a way for them to be more effective in trying to infect a human being, that's what they're going to do. These vaccines are very safe and they're very effective. What does that mean? That means that even against variants, we see that all three of these vaccines are effective. Now, how much effective they are, or how what's the percentage? It's going to vary both on a couple of things. One is the variability of the variants in the community. So how much of the different kinds of viruses are in the community? And number two is when in the process are you exposed to that variant? Is it right after you got your first dose, or is it after the second dose? Are you wearing your mask? Are you washing your hands? Are you watching your distance? Are you avoiding the large gatherings? What I would say is the key message is when you get your second dose of Moderna or Pfizer, or you get the first dose of Johnson & Johnson, about 2 weeks later, you should be protected against the virus of COVID-19. Variants will start to become an increasing challenge for us in public health, but we don't know how much so. And that's why I'm always careful to say, if you're not sure, keep wearing your mask. If you're not sure, keep watching your distance. If you're not sure, make sure you wash your hands. If you're not sure, stay away from other gatherings, because we want to make sure you're doing everything you can, because you don't know if this vaccine that you've received might also have to protect you against a new variant or new mutation of a virus that's coming through. So we want to do everything we can to keep protecting ourselves while we're also getting vaccinated.
Great. Thank you for that answer, Dr. Shah. Well, it's time to take a poll question, and for you to participate, it's very simple. All you have to do is use your telephone keypad. And the question is, how likely are you to get the COVID-19 vaccine? Any of the three, it doesn't matter. How likely are you to get the COVID-19 vaccine? Press 1 on your keypad if you say, we'll get it as soon as possible. I'll read these twice. So press 1 if you think you will get it as soon as possible. Press 2 if your answer is, I have already received at least one dose of my vaccine. Press 3 if you're planning to wait a little longer to allow others to get it first. Press 4 if you want to learn more about the vaccine before getting it. And press 5 if your answer is, I do not plan to get the vaccine. So 1 is, we'll get it as soon as possible. 2, I have already received at least 1 dose of my vaccine. 3, planning to wait a little longer. 4, want to learn more about the vaccine before getting it. And 5, I do not plan to get the vaccine. And we will give you those poll results in a couple minutes. But let's go back to the phones. And then after this next question, I think we're going to bring the Attorney General on. So let's see, Sarah, you have a question.
Did you say Sarah?
Yes, I did.
Okay. Yes.
Go ahead.
I live in Snohomish County, and it has been extremely difficult to get an appointment for a vaccine.
Okay.
And I will take anyone. And I am eligible. I'm over the age of 65.
Dr. Shah, do you have any advice for her?
Yeah, first of all, thanks, Sarah, for saying that. And this is where the rubber meets the road, right? It's one thing for me to say, look, vaccines, we're doing everything we can to get vaccines out. We've obviously administered 2 million vaccines across the state of Washington just since we started mid-December to now, which is remarkable. If you think about a new vaccine for a new virus that we are all learning about every single day. But the challenge is when you're trying to make a phone call or you're trying to go on a website or you're trying to make contact with somebody and not being able to get the appointment, that is very frustrating. That's one of the reasons that when Governor Inslee announced last Thursday that we were going to be moving from the 1B1 group, which includes seniors and now educators, and moving to the 1B2 groups starting on March 22nd, so another couple weeks from now, that we wanted to give as much time as we could for seniors to be able to get their vaccine appointments. So the advice I would give is, 1, be patient, which sounds like, Sarah, you are. Number 2, I would say keep trying, which, Sarah, it sounds like you are. And number 3, what I would say is also really be looking at not just the Department of Health website at the state, and like I said, making sure that you're checking findyourphasewa.org. That's findyourphasewa.org, or calling 1-800-525-0127. 1-800-525-0127, and then press pound, and then folks on the phone can help you. Is we also want to make sure that you're contacting those local providers, whether it's the health department or whether it's looking at the pharmacies or clinics that are listed on our website. You can see who in Snohomish County has received the vaccine, so you can start to make the contact there. And we do know vaccine supply is going to increase. Every week it's happening, and we know in the next several weeks it's going to be even more and more and more so. But right now it's really continuing to be persistent and be patient.
Thank you very much. If you're just joining us, you're listening to a Teletown Hall about the COVID-19 pandemic and the vaccine effort by the state of Washington. And that was the voice of Washington Secretary of Health, Dr. Umair Shah. And we are now joined by Washington Attorney General Bob. I understand. Bob, are you on the line?
Attorney General. Sure am, Doug. How are you doing?
Hey, great to have you here. I'd just like to introduce Attorney General Ferguson. Bob is our 18th Attorney General, and as the state's chief legal officer, he's committed to protecting the people of Washington against powerful interests of all kinds and wrongdoers. And we're fortunate to have partnered with he and his office for many, many years on all kinds of things related to fraud prevention and consumer protection. Thank you so much for joining us, AG Ferguson.
Oh, Doug, thanks for having me. It's great to hear your voice, and I hope everybody's staying healthy during these really challenging times.
We've got tons and tons of questions and listeners on the phone, many of which are interested in the vaccine, and we very well may get back to that. So if we haven't answered your question, we're going to get back to some of those questions. But I'd like to give the Attorney General the opportunity to talk about some of the issues he's working on with regard to vaccines. And I know there have been some prosecutions, and you're tracking some wrongdoing in this regard. And if you want to just take a minute and sort of describe that.
You bet. Thanks, Doug. And I'll be brief. And also thanks to Dr. Shah for your work, Dr. Shah, and your information about the challenge that Sarah and others are having in getting vaccines. I know my 92-year-old mother recently got hers, and it's a big relief for her and for all of her many, many grandchildren and children that she does. So I'll be real quick, Doug, just to give folks a sense of what we in the Office of the Attorney General are seeing related to COVID, particularly in scams and trying to exploit Washingtonians and take advantage of really their sense of unease and nervousness about COVID-19. So just as an example, we have literally had to bring lawsuits against individuals, for example. One was a national news story about an individual here in Washington State. His name is Johnny Stein, and he promised that he, as a scientist, had devised a vaccine, a cure for COVID. And he was literally going around the state and the country putting this substance into people's body and charging them for this. Look, it was no cure. It was no vaccine. It was a scam, pure and simple. And we had to take him to court to put a stop to it and, by the way, have him pay a significant fine. We also have seen cases that we've had to bring against companies that claim their products, for example, Doug, can protect you against COVID-19. So just to give one example, there is a company, it's called Pure Environment, and they're a mold remediation company. And this mold remediation company claimed that their products would protect you against COVID-19 if you use them. Not true. So those are just two examples. There are many others. Of course, Doug, as you know, these scams always take different forms, but the bottom line is if someone or a company is saying they have a cure, saying they can protect you, do not believe it. That is a scam. One other thing we're seeing a lot of, Doug, is folks, frankly, taking advantage of that wanting of folks to be able to get a vaccine and people being desperate to get that vaccine. And we were seeing scams of individuals calling or texting Washingtonians and asking, saying that they have a vaccine, but you have to pay for it. As you know, Doug, as Dr. Shah knows, you do not, and frankly, cannot pay for the vaccine. That's not how it works. So if anybody is saying you can get to the front of the line, you can get a vaccine only if you pay for it, that is not legitimate. That is just absolutely a scam. So those are just a few things in trying to keep this short that we are seeing. We obviously encourage, Doug, anyone to contact our office, as we always do, if they see a scam along those lines. Maybe just the last thing I just will make a mention of and happy to chat about more is price gouging is always a problem when there's any kind of a natural disaster or, as we're seeing now with the pandemic, prices going up a crazy amount for hand sanitizer, for toilet paper. So we've been doing a lot of work in that area. And just want to point out, Doug, thanks to the help of AARP, we in the AG's office, I'm actually proposing a law that is specifically geared towards eliminating price gouging in those circumstances. It just recently passed the state Senate. It's on to the House. We feel really good about it and just really appreciate AARP helping us with that really important bill that will help Washingtonians in the future.
Yes, thank you very much. If you're just joining us, that's Bob Ferguson, our State Attorney General. And I think you and I were both sort of surprised last year when we saw this going on and learned that there was no specific bill expressly outlawing price gouging. So you really took the leadership there and made that happen. It looks like that bill is going to pass. We do have a question for you from Catherine. Catherine, you have a question for the Attorney General?
Yes, I have a question about pandemic unemployment and assistance fraud. I've been a victim of identity theft in that I got a letter from the Commonwealth of Kentucky, where I've never lived or worked, saying that I had been awarded pandemic unemployment assistance. This is obviously a fraud. I expect from having several systems where my information is stored compromised over the years. What should I do?
So thanks for that question, Catherine. And Doug, you may have some thoughts as well in case you're hearing of similar stories. So first of all, Catherine, I'd say I appreciate the fact that you are being thoughtful about being suspicious about this, that this may not be legitimate, which is always a sensible course to take. Number two, if you are willing and able to notify my office of what you've received, that can help my team take a look at it, but also to see if we're getting similar complaints across Washington State from other consumers. So we have a website, the Office of the Attorney General here in Washington State, and it's an easy to go there and simply provide the information in terms of a consumer complaint. So that would be very helpful if you're willing to do that in terms of getting that information to my office, where we can then follow up with it as well. But I think without having seen what you've got there, Catherine, it sounds like you're taking the appropriate step of being suspicious that may not be legitimate. And Doug, have you heard of situations like that as well?
Yeah, I mean, I think we're getting some reports of especially a lot of texting scams where people are getting texted saying, hey, I'm from the COVID relief fund, and, call this number or go to this linked website. And of course, you go to that website and so what they're really trying to get is your personal information. In order to get COVID stimulus check, you need to give us all of your personal information. And so there's a lot of emails going that, robodials and texts. And I think, what would you say the general advice is about that, just in terms of to not give your personal information? Similar to what you've already said, I guess, which is you shouldn't have to pay for the vaccine. You shouldn't have to give people your social security number you don't know in order to qualify for a stimulus. But that's going on out there. That's
exactly right. That's exactly right. Don't respond to those. In fact, I'll just add my wife. My wife, Colleen, received a text message connected to that stimulus check. Hey, it said, go here to get your stimulus check. That's not the way it works. But again, these scams will take different forms, Catherine, and to everybody on the call. As Doug knows, the key is to follow some, I think, basic principles. Don't give out your personal information. If it seems too good to be true, hey, you can get to the front of the line on a vaccine if you pay $100. If it seems too good to be true, it is too good to be true. To be skeptical about that, and even to the level of if you want to donate to a charity who's helping folks out during a pandemic, do your homework on that charity to make sure it's legitimate before you turn over your hard-earned money. So in all these different areas, being very cautious about your credit card information, your personal information, before you turn over your money or share your information is very, very important.
Yeah, thank you for that. It's Attorney General Bob Ferguson, whose team is really aggressively pursuing some of this wrongdoing that we're hearing. Well, let's get the poll results. How likely are you to get the COVID-19 vaccine? We had quite a response to that. 31% said they will get it as soon as possible. 55% said they've already gotten at least one dose of the vaccine. So that's like 86% are either going to get it as soon as possible or have already gotten it. That's excellent. And that may be referring to Dr. Shah's statement about how there's more demand right now than, at least we don't have that problem. Planning to wait a little longer, 7% want to learn more about the vaccine before getting it, 5%, and only 2% say I do not plan to get the vaccine. So that is good news in terms of the whole question of vaccine hesitancy. If you're just joining us, you're listening to a Teletown Hall on the vaccine and the coronavirus, and we're going to go back to the phones now. Florence from Yakima. Florence, are you on the line?
Yes, I am.
Go ahead.
The at-home people that's 80 years old or older, or 70 years older, are not being contacted. I have a neighbor that's 90 years old. She has not. And there's a lot of manufactured homes in this area that are 55 or older that have not been vaccinated. I have, because my niece was a RN, and she brought me one. That's where I found out, finally, that there was, Inslee had said that all people over 80 years old had been vaccinated, or over 70 years old. So that's what I was concerned about, is the people in these courts that nobody contacts them, and they don't have ways to get there. So,
thank you for that. Dr. Shah, do you want to address that, just about how proactively you're able to reach out, or is the county public health departments able to reach out to this vulnerable population of older people?
Yeah, Doug, did you catch where she was located? I didn't catch where she was. In Yakima. Okay. Yeah. So, and first of all, the Yakima Health Department, led by Andre Fresco, is fantastic, and I just want to give a shout out to them. This has been a challenge because we have been working with our local partners, and they're doing everything they can to get the word out to seniors. But obviously, you're hearing that here are a group of seniors who have not gotten that word. And so we want to do everything we can to improve on that. And so certainly if Doug, we can get some of that contact information, we can pass that along to Yakima Health Department so that they can, make contact with and at least be aware of that situation. But I will say in general, what we're doing is twofold. One is to raise the awareness throughout the state that seniors are eligible above the age of 65 or above the age of 50 if they live in multi-generational households. And number two is that we want to do everything we can to make the process easier for them to sign up to get vaccines. And that has not been the case throughout because it's been a challenge, especially for seniors. And so we are doing everything we can to enhance the system. So it's not just about the numbers. It's not just about making sure that we're using a lens so that everybody around the state that's eligible is able to get the vaccine, but also the user experience, that somebody who tries to get the vaccine, that at least trying to go through our Department of Health website, it's easier for them to navigate. So we're working on a number of things related to that. And then the final thing I would say, Doug, on this one is that we are recognizing that there is a real challenge when it comes to, it's one thing to set up a clinic and a vaccine site and say, hey, come to us. But we know with seniors and certain populations, it's going to be harder for those individuals to get to those sites. So we're also working with our local partners and even at the state to develop these mobile teams, if you will, that can actually go to vaccinate. And again, it depends on which community you're in, on what level of those teams are. But that is something also that's being worked on behind the scenes, and it's already been actually implemented across the state as well. So there are a number of things that we're doing, but I do think if we could get some information from her, Doug, that would be great, so we can provide it to Yakima Health Department.
Okay, that's great. We will do that. We will pass on that information. Adri from Vancouver.
Hi, I have a question. I am already been vaccinated by the mass vaccinations at our fairgrounds, which was I was very lucky to get it. I was one of the ones in the very beginning, the first day it opened, the first 2 hours, and be able to choose my day and my time, unlike others who could not and would spend days and days trying to get through. So I have a question now for those of us who have two. And we know because of the variants, we know that in the news, Moderna is building a booster for it. And Pfizer is the one I have, but I assume that is also happening. So the question is, when it's time those boosters are ready, and they say that people that had gotten the regular 2 shots or 1 shot for J&J, and they need those, are we going to have to go through the same miserable process of trying to go and log in, or will the state health department and the counties have records so that they can contact the people that already had gotten the 2 and be able to enable them to go and actually be able to log on and get a time and a place to get the booster? I know that's far ahead, but I am assuming that the health department, as well as other parts of the government, including Governor Inslee, is looking at this possibility. Thank you.
Thank you for that question. And I will say that is quite far ahead. Right now, I think the main focus around the country, not just state of Washington, but around the nation, has been to really get as many vaccines into the arms of Americans across the country as quickly as possible, and to make sure we're doing that equitably as well. So I think you're right that we are looking at what does that mean for the future. And what you were referring to, just so everybody is aware of this, that really what a booster is, in it maybe a simple way to say, is that we all know that there are 2 doses for these 2 vaccines, Pfizer, Moderna, and we have 1 dose for Johnson & Johnson. And those 3 vaccines mean that once you get the appropriate doses, you are now protected from the virus. Now, that doesn't mean that it's 100%, so we still want people to take appropriate precautions, especially when they're indoors, right? When you're outdoors, it's a little bit less of a transmission risk, but indoor crowded gatherings are absolutely what we want people to avoid. But what the talk is that in the next, maybe down the road at the end of the year, when we get back to sort of flu season, that it is very possible that once we finish the round of vaccinations for all Americans, we may come back and say, given where we are with variants or mutations or changes to the virus, that we may need to give an additional booster dose. We do not know that yet, nor do we know how that would all play out yet, nor do we know what the vaccine's going to look like yet. So there's a lot of unknowns, but I will say that this is something that's in the back of our minds, but number one focus right now remains immediately getting vaccines into the arms of Washingtonians.
Great, thank you very much. So here's a question that came in on Facebook for Dr. Shah, I believe, and I've had this same question. My family's argued about this question. What does efficacy rate really mean? Does it mean becoming infected with COVID, or does it mean becoming sick? So, for example, we're told Johnson & Johnson vaccine is 66% effective against COVID, but 100% effective against severe illness. We're told that Pfizer and Moderna are 95% effective. Does that mean they're 95% effective against becoming sick and 100% effective against severe illness? I hope that isn't a convoluted question, but you know what I'm getting at.
Yes, I do. I think that, go ahead.
No, that's it. Go ahead.
Yeah, what I was going to say is that when we talk about vaccine efficacy, what we are saying is that we can calculate how well a vaccine works by looking at the difference in new cases of the disease between the groups that receive the placebo vaccine versus the groups that actually received the true vaccine. And that's the vaccine efficacy. So what the other way of looking at it and the other way of describing it is that the number you get, let's say 95%, is the efficacy rate. This tells you that under the same conditions as the study, the vaccine reduces the risk of infection by 95%. Okay. And why that's important is that, remember, there's still 5% that it doesn't. And this is why I want to be really careful with everybody and say, look, absolutely, don't hesitate, vaccinate, get vaccinated. We want to do everything we can, but let's be smart about what we do once we get vaccinated. That doesn't mean you just walk in and say, I'm going to have a huge gathering of lots of people indoors, and I'm not going to have masks and do whatever I want. I'm not going to worry about it. We want you still to take precautions. That's what you would expect from your doctor, and that's what we're going to continue to recommend until we have more and more information about this.
So just to be clear, that 5% in their example that, say, took the vaccine but still got it, they nevertheless don't get as sick. Is that what the research is finding because they had the vaccine? I guess that's another piece to this. I know we still have to be careful. 5% will still get it. But as I read the media reports about the research, having the vaccine, even if you get it, means you may not get quite as sick. Is that right?
That's right. That's right. So, and by the way, there was a great article that came out in the New York Times back in, I want to say before the end of the year, maybe mid-December, that was really about efficacy, and it really went through the math and explained it. So I think that I would definitely refer you to that one. But what I would say on this is absolutely what we're also seeing is that if the vaccine does not completely protect you, at least it makes it less likely you're going to have severe illness, severe disease, that you're going to have to go into a hospitalization that's going to require some severe type of response like a ventilator or things of that nature. That's why vaccines are not just about preventing you from getting the disease, but it's also preventing you from getting a severe form of that disease. That's why vaccines work, and that's why we don't want people to hesitate.
Great. Well, we're coming up to the end here. We have time for a couple more questions. You've been listening to Dr. Shah from the Washington State Department of Health and Washington Attorney General Bob Ferguson talk about the state's efforts to distribute vaccinations in the midst of a corona pandemic. And we have tons and tons of people left in the queue here. So I'm just going to try and plow through a couple more questions. And Bob, jump in here if you have any comments you want to make before we end here. Go ahead, Marsha from Stanwood.
Oh, hi. I got my first shot of Pfizer on February 9th, and I was actually due today. I just recently got an email so that I could even try to get the second shot, but they were full within an hour. I was only outside about an hour, and then I came in and I noticed that it was on there, and I tried to get into it. Everything was full. So my question is, if I can't get in there in the 6 weeks time period, is it still going to be effective when I finally do get the shot? Second one.
Yeah, the question is, expire. Does the vaccination expire, I guess, is the question.
Right. So there's been a lot of talk about this. The Pfizer vaccine, as we know, is 2 doses, 21 days apart, 3 weeks apart. The Moderna vaccine is 2 doses, 28 days apart. We do know, and CDC has given us this flexibility that you can go beyond that 21 days, and in fact, what they've referred to is about another few weeks beyond that. So if you don't get it exactly on 21 days for Pfizer or exactly on 28 days for Moderna for the second dose, you should still be okay. Now, you don't want to go 6 months after, right? So there's a tincture of time, but if it's a couple of weeks here or there, it can actually be worked on. But I do want to focus on the first thing, which is that where you get your first vaccine, by and large, should be where you get your second vaccine, and they should be able to make arrangements because we are getting doses for them for the second dose of vaccine. So they should be able to get you that vaccine, and so please contact them again.
Okay, thank you for that answer. Mario from Seattle. Mario?
Oh, yes. Hello?
Yes.
My question is about, I don't have internet access, and when I go to the Safeway pharmacy, they said that they give me a website, and I went over there and they give me a website, but I don't have any computer access.
Yeah, that's the big issue. Thank you, Mario, for that. And that's why I was saying that it's not just the web tools, but all these agencies or partners have phone numbers. Please call them if you haven't been able to get on the website, or you can call 1-800-525-0127, 1-800-525-0127, and press pound, and folks can help you at Department of Health as well.
I think that's a really important thing to remember because we are all so immersed, many of us are, in everything internet, but there are still a lot of people who don't have the internet, and especially in this category of our folks who need the vaccine the most. Debbie from Seattle.
Yes, I went and got my first dose at the Amazon facility through Virginia Mason, and the one thing I noticed is probably 80% of the people there were between like 30 and 20. There were tons of young people. Where are the older people that are supposed to be getting their vaccines? And is there some reason they're not able to sign up because all these young people are getting in ahead of them?
Yeah, thanks for that question. I don't know specifically about that site or when it happened, but I will say, remember there are a couple of categories that are also in addition to seniors, and that's the individuals who are health workers, and that's also individuals who are educators. So depending on when this was, you might see people who are younger also getting vaccine, and that's why I want to make sure that our seniors are doing everything we can or they can to get vaccinated in the next couple of weeks, because on the 22nd we'll start to have the next phase of opening up to essential workers who are also many times younger populations. So please do whatever you can over the next couple of weeks to get vaccinated.
Okay. Time for a couple more questions, then we're going to have to wrap this up. But this has been extraordinarily helpful, and I really appreciate our guest, Bob Ferguson from the AG's, the Attorney General, and Dr. Shah from the State Department of Health being online. We have over 6,000 people on the line. Marilyn, go ahead from Seattle.
Hello. I have rheumatoid arthritis, and I'm being treated with immunocompromised medication. Now, where am I on the list? I notice you list. I have to go in every 6 weeks to get treatment, so I'm exposing myself. My immune system is suppressed, so I'm more susceptible to just about anything. I don't see other states have allocated this. I'm 60 years old too, so I'm too young according to the 65-year-old cutoff. But why do you not consider immunocompromised? The only thing you have is for solid organ transplant on your list. What about those who suffer from autoimmune diseases and have to take immunosuppressive medication? Where do we fit in? And I'm also disabled.
Yeah, thanks for that question. And this is really hard, right? We're trying to do whatever we can to get vaccines to those who are most at risk, and we're following the CDC guidance in terms of those who are at increased risk, and there's another category of who might be at increased risk. And I'll be honest that there are going to be a lot of people that are going to look at those lists from the CDC and say I should be in that list, and my condition is not. And there are going to be other people that obviously are going to say that it's absolutely the right list. So I do think that this is the challenge that we have. And so the first and foremost thing is I want to make sure you're contacting your healthcare provider, the person who's prescribing your medications, because we do want to make sure that if someone is immunocompromised and or using corticosteroids, for example, or they're using some immune weakening medicine, which we would not know just by this phone call, that you also have the ability to be able to make that contact. So that would be the first thing. And the second thing is just it's a vaccine supply issue. And we do know that once we get past those with 2+ medical conditions, again, according to that CDC guidance, or eventually 1+ medical condition, we will be opening up to others. So I think your time will come. Vaccine supply is increasing. So please be patient. Please be persistent. Please contact 1-800-525-0127. And Doug, I did want to say thank you to Bob Ferguson for just his incredible work as Attorney General. And I just want to say thank you for welcoming me to the state of Washington. He's been fantastic about doing that. And I just want to say thank you to all of your listeners, because this has been really helpful for us to get your feedback on what's happening across Washington.
Dr. Shah, this is Bob. Thanks so much for saying that. And Doug, I know we're nearing the end of our time, but one thing I did neglect to mention earlier on that I do want to at least just put out there for our listeners, and I understand the focus on how folks can get the vaccines, which makes a lot of sense. I do just want to mention, a lot of folks are struggling economically right now, and there is a proclamation from the governor that says that nobody can be evicted right now from their place of residence for an inability to pay the rent. And so I just want to make sure that folks, we have thousands of people on this call, and make sure that they understand that, hey, if they or someone they know and love is in a situation where they are unable to pay the rent, you cannot be evicted during the pandemic under the current rules. And Doug, we've received literally, I think, over 7,000 now inquiries and complaints about this from tenants who are concerned. So it's been a very large body of work. We also, of course, are explaining what rights there are for landlords as well to folks. But I just want to make sure folks know they contact my office if they have any concerns along those lines at all. And so nobody can threaten to evict you. Nobody can give you late penalties. There's all sorts of protections for tenants right now, and just want to make sure folks understand that, and they know they can reach out to my office, and my team will respond to them right away if they reach out.
That's really good information. And how long is that in effect, that moratorium on eviction? Is it in perpetuity, or is there an end date to that, or what?
Yeah, I do not believe there's a specific end date right now. Right, so right now it's open-ended at this point, but of course there will come a time when that will come to an end. But it has been in place now, Doug, for I think now close to a year. I believe that the governor has that in effect. So the number of inquiries that we're receiving, has slowed down a little bit, but we're still receiving hundreds every single month. And so it's a lot, but my team does respond to every one of them. And so we just encourage you, those who are on this phone call, whether it's yourself or somebody you know, they should not hesitate to contact my office. It's just right on our website. It's easy to find. And we have a large team in place who handles all of those questions and inquiries and complaints that people may have.
Excellent. Thank you very much. Dr. Shah, any final words before we wrap up? I really appreciate you taking the time. I know it's a very busy time for you, and you're new to the job, and you're right, this is a challenging time to come to a new state and find out what's going on here. Any final thoughts?
Well, I just want to make sure everybody has the website and the phone number, Find Your Phase WA, findyourphasewa.org, or call 1-800-525-0127. Again, don't hesitate, vaccinate. I also want to just make sure that everybody knows whatever vaccine that you're eligible for or offered, get it. That is the key message. Do not wait for the perfect opportunity. Get the vaccine. Whatever is offered, get it. And really, honestly, I just want to thank you, Doug, and your team at AARP, and I hope we can continue the partnership of doing whatever we can. I'm sure Attorney General Ferguson appreciates this as well, that we can do whatever we can to help our seniors through this very difficult process. And so just really look forward to that continued partnership with AARP. Thank you for what you're doing, and thank you to our seniors for everything they do. And just remember, we want to make sure you get vaccinated, so please do everything you can to get vaccinated, and we want to do everything we can to get vaccines to you as quickly and as equitably as possible.
Don't hesitate, vaccinate. I heard you say.
Right.
Right? Good bumper sticker.
You got it.
Well,
you got it.
I want to thank both Dr. Shah and Attorney General Bob Ferguson for joining us today. In the face of this crisis, we're trying to provide information. All of us are trying to provide information and resources to help older adults and those caring for them. And these two gentlemen have taken time out of their busy schedule to help us with that today. We had thousands of people on the phone. If we didn't get to your question, I apologize. But for more information about the coronavirus in Washington, you can visit us, or you can visit doh.wa.gov or call 1-800-525-0127. It's the number Dr. Shah gave out. And thank you all for participating in this discussion on this important topic. Again, we apologize if we didn't get an answer to your question. You can also obtain valuable information on our website at aarp.org/WA vaccine. Thank you all and have a great afternoon.